Good day, Doctor. We are from Group 7 and we are going to present our data science project, which is a comprehensive analysis of HIV trends and insights in Malaysia. So these are the analysis. First we have Kausalya Pratis Varraj, then myself Nimul Padanachatan, and we have Nagasaraswati Murugan. So this is the overview of the entire project. So this is the project description. The project description is about HIV trends in Malaysia from the year 2000 to the year 2022. So this is a problem statement. The problem statement is assessing the historical events of HIV cases in Malaysia from the year 2000 to 2022. Second is understanding the impact of socio-economic, demographic and geographical variables of HIV cases in Malaysia. The third is forecasting the future of HIV cases in Malaysia. These are the objectives. So first we have to analyze historical HIV data to uncover trends, patterns and correlations. Second we have is identify socio-economic demographics, geographical factors influencing HIV cases. And third, we have to develop predictive models to forecast HIV cases. So solutions architect. First we have data collection. In data collection we collected 13 data sets from data.com, from various websites. Second is data pre-processing. In data pre-processing, we cleanse and integrate and basically clean up the data. Third is descriptive analysis. And what we did is we conduct exemplary data analysis to understand the trends, the distributions and stuff like that. Fourth is diagnostic analytics. We did statistical and machine learning analysis to identify the factors influencing HIV cases. And the last one is predictive analytics. We use Power BI's model to create a forecasting model to determine the trend of HIV cases in the future. The technical tool used in this project is Power BI. So these are the output. First is our first dashboard and second is our second dashboard. So we have 2 pages. So next I will pass it to Ms. Kausalya.
Now we are going to look at the first dashboard, which comprises of all the trends regarding to HIV cases from the year 2000 until the year 2022. First of all, the total number of people living with HIV has been a huge number of 528,000, whereas the total number of new cases is 115,000 cases. Not to say the least, the total number of deaths due to HIV is only 74,000 from the year 2000 until the year 2022. According to this chart, Selangor has the highest number of cases related to HIV with a huge number of 842 cases, whereas Labuan only has 15 cases in the past 22 years. If you look at this particular chart over here, HIV cases based on sex, the male population has always had a higher number, which then dropped in the year 2009 and then has been quite steady until the year 2021. If you look at the number of cases for females, it has been only at around 466 cases in 2001 and has seen a constant line until the year 2021 with 279 cases. From this we can see that the number of cases for males has increased and then decreased and then been consistent. But for the females, the cases have been consistent from the start of the decade until the end. According to this chart, annual new cases versus deaths and people living with HIV among children, you can see that the average number of deaths, average people living with HIV and average new cases have all different distinctive values. The average of people living with HIV is so much more large compared to the average number of deaths. This means that even though you have HIV, you still can lead a normal and healthy life like others. Next, we look at the number of HIV deaths among children. Here, children aged 0 to 4 comprise of the largest number of deaths among the children's category, whereas the lowest is at 16.41%, which is children aged 10 to 4. According to this chart, we can derive that children aged 0 to 4 are more infected and are dying more when it comes to HIV because they do not receive the right kind of treatment at their age, and also because treatment for children 0 to 4 is very, very critical. We don't really get any treatments given for them at that age, at such a young age when their immunity hasn't even developed yet. Next, we are going to look at the HIV incidence rate. Now, in this graph, we will look at the HIV incidence rate and prevalence rate among adults. The yellow color symbolizes the total incidence rate, whereas the blue color symbolizes the prevalence among adults. From this chart, we understand that adults have occupied this much of incidences in a whole compared to the entire incidence rate. Next. That is all from me. My friend will take over the second dashboard. Thank you.
Okay, now I would like to go to the next slide, which is the mother-to-child transmission. If you have seen just now, my friend has explained about the HIV deaths among children from the age group of 0 to 19. From the age group of 0 to 4, it has made the highest deaths compared to other age groups. Why is it? Because of the mother-to-child transmission. If you have known mother-to-child transmission, what is it? Mother-to-child transmission is the transmission of infection from a mother to child through pregnancy, breastfeeding or childbirth. If you compare the analysis from 2014 to 2022, the cases has been decreasing. And if you have seen from 2016 to 2022, the cases has remaining the same. Why is it? Because now we have enhancement of prevention of mother to child transmission in Malaysia. Second chart will be the mother to child transmission rate versus early infant diagnosis. So if you can see, in the year 2015, the mother to child transmission rate has been 640 cases, while the early infant diagnosis has been 260. So from the total of 640 cases, only 260 infants has been diagnosed with HIV. Moving to the next chart, which is the coverage of prevention of mother-to-child transmission, which is P and PCT. These are the prevention methods that a pregnant woman with HIV will receive. Example of prevention methods that HIV a pregnant woman will receive are HRVs for P and PCT and also lifelong ARTs. So if you can see, the yellow color chart is describing about the ARVs for P and PCTs that the HIV pregnant women are receiving, while the blue chart is describing about the lifelong ART received by the HIV pregnant women. Moving on to the next slide, which is ANC-based HIV testing for pregnant women. What is ANC? ANC is antenatal care, which is received by pregnant women. So if you can see from the year 2019 to 2021, the ANC HIV testing received by the pregnant women are increasing. Okay, in the next slide we can see the analysis of the estimated pregnant woman with HIV who needs ART and also who has received ART. If you can see, the yellow color chart is describing about the number of pregnant women living with HIV who needs HIV and ART treatment is higher than the number of pregnant women living with HIV who has received the ART treatment. So if you can see, in the year 2010, 2014 and also 2020, the pregnant woman living with HIV who needs ART treatment is remaining higher, and also the number of pregnant women who has received the ART treatment has remained lower than the pregnant woman who needs ART. Okay, the next chart will be describing about the children who needs ART and who have received ART. If you can see, the children who needs ART are higher than the children who has received the ART. So this is about mother to child transmission.
Thank you, Ms. Naga. Let's go to the previous dashboard. I'm here to explain about the predictive analysis of the HIV cases. So as we can see, from the year 2000 to the 2022, it has been decreased drastically. This is because of the awareness and campaigns that have been conducted in schools, public libraries, and just anywhere in Asia. So in the year 2023 onwards to 2030, we predict that it's going to be stagnant because of the awareness and campaigns is all what we have did here. And it will continue to be stagnant until we take better measures to solve this problem. So one of the solutions that I will give is, that I would suggest is that the government give antiretroviral therapy for free for all the mothers to prevent cases from like the pie chart before, from age 0 to 4. We can eliminate this if we can reduce this if we have free antiretroviral therapy for mothers. So next I will talk about the outcome and insights of this project. So what we derived from this project, we derived high risk areas and potential influencing factors for HIV cases. The next is we discussed about the effective of past interventions. And the third is we have recommendations for the targeted interventions. So thank you from us.